Addiction isn't just wanting to use a substance repeatedly. It's actually your brain being rewired to compulsively get more of it. Long-term substance abuse might cause dependence, a reliance on taking a drug to function normally. For example, when drug use is stopped, cravings and withdrawal symptoms like anxiety, insomnia, and vomiting can occur. You might have heard of opioid replacement therapy, or ORT, for treating heroin addiction. It might seem like we're adding fuel to the fire by giving drugs to treat drug addiction, but how does it actually work? One of the most commonly used ORTs, buprenorphine, binds to the same receptors in the brain that opioids like heroin would, but it has a much smaller effect. While the euphoric effect of opioids is reduced with ORT, it alleviates cravings and other nasty withdrawal symptoms for a while, which allows people to function without the drug. Using other opioids when on ORT feels less pleasurable, and buprenorphine is also less likely to cause overdoses.